Hi everyone, good evening. In this lecture series, we are going to discuss about the design thinking concept, that is IoT, Internet of Things in the healthcare. So where we are using this IoT in the healthcare. So the problem statement. So while coming to that of the problem statement, the first thing we have to know what is a design thinking. So this design thinking, it is nothing but it is one of the human-centered approach to innovation. It plays a crucial role in developing IoT solutions that prioritize empathy and the user needs. So here we are going to see how the empathy part that has been fits to this DT concept. Suppose if we are going to incorporate this IoT in the healthcare, the first thing is we have to understand the patient's need. So what do you mean by the empathy means? It involves the understanding of the experiences, emotions, and the challenges faced by the patients. In healthcare IoT design, it's essential to empathize with the patients to identify the needs, preferences, and the points. This could involve conducting some of the interviews and observations and research to gain by their patients' daily routines. What are all the health concerns we are having for this patient, and we have to interact with what are all the technologies that we are using. While coming to that of the developing user-centric solution, it drives this concept, and this Internet of Things meets the specific needs preferred by the patients. We are going to empathize with the patients. At the same time, what are all the things we are using and how we are going to create that is, we are using the interfaces, wearable devices, IoT enabled healthcare systems that are very very easy to use, accessible, and responsive to the patient's concern. For example, if we are using the IoT devices, it can monitor the vital signs, track medication, and it provides the real-time feedback to the help the patients to manage some of the chronic conditions and improve their overall being. The next part is empathy part. So we are using the patient's experience, and they are providing ensuring the privacy and security. For example, if we have taken the design fosters positive patient, we have to prioritize the empathy, compassion, and respect, and we are going to incorporate that feedback loops, personalized feedback, and supportive communication channels. Designers can create that engage, educate, and motivate patients, ensuring the privacy and security. So it respects the patient's privacy, confidentiality, and security concerns when designing the enabled healthcare solution. It has to prioritize the data protection and secure communication. The next one, we are going to see the challenges and opportunities and how it has been used. Suppose, for example, it has to understand the diverse needs, preferences, and behaviors of the stakeholders involved in the healthcare delivery and management. This helps designers empathize with the end users and tailor some of the solution to address their specific requirements and pain points. While coming to that of the defined part, we are seeing the problem framing and identifying opportunities. We are going to face some of the key challenges or pain points, and this involves conducting the research, interviews, observations, while identifying the IoT technology, define areas for improving the patient care, enhancing the clinical efficiency, enabling remote monitoring, and the preventing healthcare. The stakeholder analysis. This is the image for the stakeholder analysis, how it includes the patients, caregivers, health care providers, administrators, and to understand the perspectives, priorities, and pain points. So medication adherence and the real-time monitoring. Ideate through the phase It remains understanding and addressing the preferences, including patients, caregivers, and the care providers. It uses the uses the centered design principle to ensure that the ideas are relevant, meaningful, and responsive to the needs. While coming to that of the prototype tools and materials, the designer have to choose that for IoT enabled healthcare solution. Depending upon the complexity of the solution, the prototyping tools may include the software development platforms, 3D modeling software, hardware components, sensors, and of the IoT devices. While coming to that of the building low fidelity prototypes, it provides the representation of the proposed solution. It can be sketches, paper mocks, cardboard models, or the digital wireframes, the structure flow and interaction of the IoT enabled healthcare system of the device. So by using the prototype, we can integrate the IoT components and conduct the pilot tests and demonstration. While testing, we are going for the functionality and user experiences, the feedback sessions to evaluate the functionality, and while coming to that of the refinement, it gathered from using testing, designers iterate on the prototypes, integration of the IoT components, and developing high fidelity prototypes. Thank you.